Hello, ladies and gentlemen. My name is Corey Johnson, and welcome to Relationship Management. Today's topic is going to be about stank puss. Doom doo doom 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 stanky pussycat. Doom doo doom stanky puss. Sexual activity stank puss. With a person on drug stank puss. Can indirectly stank puss cause of vaginal odor stank puss due to increased risk stank puss and infection alter the body chemistry. While the drugs themselves don't directly cause a change in vaginal scent, several factors connected to drug use can lead to stank puss. A lot of these ladies are stupid. You get involved with men that's on drugs, and then you keep the men, understand, instead of abandoning them or getting rid of them. You keep them knowing that they're still on them drugs. A lot of these men are on cocaine, and they are on angel dust. They are on all kind of LSDs, PCPs, all kind of cocaine, or heroin, or any type of dangerous drugs. And when a person be on them drugs, it makes their brain don't function well to take a bath. You know what I mean? And their body hygiene be very bad, such as the ass crack be funky a lot, the dick be stinking a lot, and a lot of these ladies, you'll keep them and you'll suck his dick. You know what I mean? His dick be all dirty. A lot of these ladies be talking about that online. How they man penis be stanky and have maggot crawling on it and all that white build up around the dickhead and stuff. And a lot of these ladies be saying online on the YouTube videos that, they still suck it anyway because they love it. They love the man, you know what I mean? So they make themselves love the taste of his penis even though it be foul and musty and making them sick, But the increased risk of infection in sex with a partner who is using drugs, it can heighten the risk of acquiring an infection, that leads to a foul vaginal odor, The bacterial or vaginosis, semen is naturally alkaline, and its introduction into the acidic vaginal environment can temporarily disrupt the pH balance. Drug use may be associated with decreased attention to personal hygiene. And in these cases, semen can introduce more bacteria than usual, promoting the growth of unhealthy bacteria. BV is characterized by a fishy odor, then grayish discharge, itching, and burning. Sexually transmitted infections, drug use often involve riskier sexual behaviors, such as having multiple partners or not using condoms. A lot of ladies be on drugs too, and they don't be thinking to wash their pussy because drugs make you stupid. You know what I mean? And they be thinking and stuff like that. Very, very, very bad. Which raises the chances of contracting an STI infections like chlamydia, gonorrhea, and trichomoniasis are known to cause unusual discharge and odor. The altered bodily fluids and hygiene. Drug use can affect a person's body chemistry and hygiene habits, which can be transferred during sex. Changes in semen. Some substances can alter the smell of a man's bodily fluids, including semen, which this may not be the root cause of a stink. It can mix with vaginal bacteria and contribute to an unpleasant odor. Poor hygiene. People with substance use disorders sometimes neglect their personal hygiene. A lack of regular bathing can lead to an accumulation of bacteria and in like a musty type of a sweetish odor in the genital area that smells like onion, you know what I mean, which can be transferred to a partner during sex. You know, other related factors are even without a new infection, a partner's drug use can contribute to a smelly vagina in other ways. Unsafe practices. Oral sex with someone who has poor oral hygiene or is taking certain drugs can introduce different bacteria into the vagina, throwing off its natural balance. Immune system effects. Chronic drug use can weaken the immune system, making a person more susceptible to infections. This can lead to a cycle of recurrent infections such as BV or yeast infections that are hard to shake. What to do if you notice a bad smell? If you notice a foul vaginal odor after having sex with a man who uses drugs, it's a good idea to speak with a healthcare provider. They can test for infections and advise you on the best course of action. If you are concerned about your partner's drug use, resources such as the Substance Abuse and Mental Health Services Administration, the National Helpline, can offer confidential support and treatment referral information. Have you ever heard of the saying that, weed and marijuana can fry the brain? Well, it can if you smoke it chronically. If you smoke too much of it, it can make you have like short-term memory, or it'll make you to forget to wipe your booty like you're taking a poop, or it'll make you, forget to brush your teeth, and you be talking in people's face, you know what I mean? And then whenever a person make a face as though you stink, you would get angry or mad, you know what I mean, at them, just because they don't want to tolerate the funk of your halitosis, And I had a woman in my past that had mental behaviors like that. She'll wake up in the morning and start talking in my face, you know what I mean? And whenever I cover my nose, she'll make a very bad face and look at me and say, "You don't love me." She'll get angry and pissed off and fucking angry and mad at me just because I don't like the smell of her halitosis. And that's not fair. She think that is love of me supposed to want to smell her funky breath and to put up with that. No, that's not love. That's abuse, because you making me sick because your mouth smelling like somebody's shit, you know what I mean, or something. And a lot of these ladies, are people that's on drugs, you know what I mean, or you smoking too much marijuana, it can make your mind fucked up like that. It'll make you do all kind of bad things and make people sick, and make people very unhappy with you. Drugs or smoking too much weed chronically, it can make you have bad hygiene. It'll make your mind slip to wash your coochie. You know what I mean? And you'll have problems as a woman. That's why it's very important. You need to really make sure, if you want to look for a person that you want to live with for the rest of your life, you need to make sure that you don't have no mental issues, because you're going to have a lot of surprises, and she's going to be knocking your nose off a lot with her coochie hole. And she's going to be killing you with her breath. Her breath going to be kicking you in the face like Jean-Claude Van Damme or something. Trying to tell you, knocking you out. Just like the song say, by the Beach Boys, California Girls, Well, East Coast girls are hip. I really dig those style they wear. And the Southern girls, with the way they talk, they knock me out when I'm down there. These ladies would knock your motherfucking nose off with the mustard and the funk of their musty coochie. Now back about this message that I have, about stinky puss, Stink puss can be caused by a variety of factors, including bacterial infections. Bacteria can produce foul-smelling compounds that contribute to the odor of puss. anaerobic bacteria. This bacteria thrive in oxygen-poor environments such as abscesses and can produce particularly strong odors. AIDS conglobata, a severe form of AIDS that can cause deep pus-filled cysts with a foul smell. Hidradenitis suppurativa, a chronic skin condition that causes painful pus-filled lumps that can have a strong odor. Epidermal cysts. These cysts are filled with keratin, a dead skin cell protein, which can sometimes develop a foul odor. Certain sexually transmitted infections, or STIs, such as chlamydia and gonorrhea, can cause purulent discharge with a strong odor. The symptoms, in addition to a strong odor, stinky puss, may also be accompanied by other symptoms such as pain, swelling, redness, drainage, and fever. Treatment. The treatment for stinky puss depends on the underlying cause. It may include antibiotics, anti-inflammatory medications, surgery to drain the abscess or cyst, and treatment for STIs. When to seek medical attention. Seek medical attention immediately if you experience stink puss accompanied by any of the following symptoms: high fever, chills, severe pain, swelling that does not improve with home care, puss that is green, yellow, or black, especially whenever you have an orgasm or you come, and if your shit come out all green, you infected. Early diagnosis and treatment are important to prevent complications and improve outcomes. A strong vaginal odor may be a sign of vaginitis, or it may be a temporary smell related to your hygiene, lifeline, or other changes. You have to always keep yourself clean, ladies, because the whole world smelling like the funky ass touchdown puss neck you found. Take note of whether you have other symptoms. If the odor is related to an infection, you usually notice other changes like vaginal itching, burning, and discharge. Now, a lot of ladies and people may say, why does my discharge have a rotten smell? Okay, a rotten smell from the vagina or the vaginal discharge often indicates an infection, most commonly bacterial vaginosis or Trichomoniasis, which are caused by an imbalance of bacteria or a sexually transmitted parasite, respectively. A lot of ladies got all kind of tapeworms and, you know what I mean, creatures crawling down there up in your pussy. Other causes can include a forgotten tampon or uterine infection, or an STI like gonorrhea, herpes, or chlamydia. It is important to see a doctor for diagnosis and treatment, especially if there are other symptoms like itching, burning, or unusual discharge color. You smell like cat, stink puss. You smell like tuna, stink puss. You smell like rat, stink puss. You got a fat cat, stink puss.